Hello, welcome. My name is Sean Bukan and welcome to a Drug Education Vice and Control crash course. So let's jump right through it. So what are drugs? It is a chemical substance that brings about physical, physiological, behavioral, and psychological change in a person taking it. So it's a chemical substance. So for example, nicotine, caffeine, ano pa ba? Iba ba? Iba pa ang mga substansya na may nagbibigay panibago sa ating katawan. So for example, you have a fever. Then if you want to lower your body temperature, you take in antihistamines to change your temperature. So that is drugs. It's also a general term for both medicinal drug and dangerous drug. So there are also the dosages of drugs. Drugs has components that is actually poisonous when taking it in a more than recommended na amount. May mga ganun. So, let's take minimal and maximal. Minimal, it is the least amount wherein when you take this drug in a minimal dosage, it will have a change in your body. So, it is the least amount. While the maximal is the maximum amount wherein it will uh, produce the intended medicine or the intended change in your body. If you go beyond maximal, then it will be somewhat a toxic dose because you did not follow the prescribed recommended amount of drug that was prescribed to you. Abusive, if you use that drug whenever and wherever you want it. So you could see this abusive dosage when they are, you know, when you are seeing a drug user, and also when it is not legalized by the government and you use it, that is abusive dose. Lethal, if you want to commit suicide, you use this dosage because when you use lethal dosage, it will kill you. Yun. Some definition of terms: overdose. When you reach more than the maximal, actually it is overdosage of that drugs. So, when you are parang magpapacheck up ka, may bibigay kayong prescription, the type of drug and the amount of drug that is gonna be used. When you go over that prescription, that is overdose. Allergy, it's a body reaction towards anything. That, for example, itchiness, bliss, uh, nag, hindi ka nag-breathe, etc. etc. Idiosyncrasy. So, there are body reaction unique to a certain drug or any drug that ikaw lang yung nakaka-experience nito. So, for example, I have an idiosyncrasy towards caffeine na if I take it, I feel sleepy. Pero, di ba, caffeine is a stimulant, di ba? So, when I drink coffee, I actually get more sleepy. Pero, di ba, coffee is intended for you to wake up. Ayun. That is idiosyncrasy. Poisonous property. Actually, all components of drugs when taken in a beyond the maximum amount, it is poisonous. So one example ng poisonous also property is, for example, one component of a drug is arsenic. If you take this, your body will be destroyed somewhat, will be hurt. Side effect naman. So there are tulad ng vaccine, there are somewhat after you take that may mga side effect. Meron yung nahihilo, ano pa ba? Meron yung nahihimatay. So those are side effect. Pero hindi siya toxic something, pero parang side effect lang talaga siya. Pharmacology is the study of the making of drugs, manufacturing, and etc. and etc. So there are also medicinal medical uses of drugs. Analgesics, actually these are pain relievers, hindi lang for stomach ache. Lahat ng pain relievers, analgesic. Alaxan, and etc. Antibiotics, for infectious organisms. So when you, especially sa sore throat, di ba? Parang nag-build up ng bacteria dito at na-infectionan na yung mga sugat-sugat dito. Is you need this antibiotic for the bacteria to be countered. Antipyretics. When you have fever and you need to lower your body temperature, you take antipyretics. Antihistamines. So when you cannot breathe because of allergy, you take antihistamines because it parang it lowers your, or it prevents the allergic symptoms. Contraceptives, so pills, condoms that prevent the meeting of the egg cell and the sperm cell. It prevents conception. Decongestant relieves congestions of the nasal. So nasal passages are your uh, nose and some part of the nose. So sometimes when you are sick, there will be clog due to nagdikit-dikit yung nasal passages mo. You take decongestant to relieve your nasal passages. Expectorant. So when you're sick and you keep on coughing, may mga phlegms dito sa lungs ba yun? Dito sa part ng uh, body mo. So when you want to release them, you use expectorants. Laxatives, so it stimulate affection. You have LBM, sakit yung, you have stomach ache, you use laxatives. Sedatives and tranquilizers, calm and quiet the nerves and relieve anxiety. Sedatives ay actually yung difference ng sedatives and tranquilizer is sedatives has more analgesic property while tranquilizers have none or less amount. Analgesic has, 'di ba, pain reliever 'yun. So, ayun. Vitamins. Alam niyo naman ng vitamins, 'di ba? Oh. How drugs are administered? OIITI. Oral to your mouth, injection to your blood vessels, 'di ba? Inhalation through your mouth and nose. Topical or epicutaneous, meaning directly to the body site. So, parang may sakit ka sa kamay mo, may open wound dito, pag nagay mo agad yung droga sa wound mo, that is topical. Pag direct to the body site is topical. Iontophoresis or search nyo na lang sa net yung MDA, yung spelling niya. Iontophoresis is like you use a machine that produces somewhat the electric current that the body can take. Put your hands on that machine and ganun. It's the weirdest administration of drug. Yun.